Joining us live right now is Dr. Yvonne Maldonado from Stanford. Doctor, thank you so much for joining us this evening. The CDC just came out urging all pregnant women to get vaccinated. Why now? And what do you tell mothers who are currently nursing and are potentially afraid of getting the vaccine and what it would pass on to the baby?
Well, we knew when the vaccines were first licensed for emergency use back in December that the American College of Obstetrics and Gynecology were supportive of pregnant women getting vaccines. But what happened recently is that the CDC was able to analyze the data more carefully around the safety in more than several thousand pregnant women and follow their pregnancies. And it turns out that they are extremely safe and there were no safety events associated with vaccination. We also know that breastfeeding is not a danger for vaccinated women and their children, that the virus and the vaccine is not in breast milk at all. So there are reasons to really update people as quickly as possible.
All right, let's move on to children and COVID. We're seeing an unprecedented number of kids wind up in these hospitals nationwide. Should fully vaccinated parents of children under 12 who are not yet eligible to get the vaccine, should they be changing their behavior to keep their kids safe? Are play dates now on hold? What about travel?
Well, it's important to remember that the reason we're seeing a surge is not because vaccines aren't working or practices that we did before aren't working. It's because the virus is more transmissible now because of the Delta variant. And so with more people unvaccinated transmitting disease to others, we're just going to see more people infected. That doesn't mean that the vaccines aren't working, masks aren't working. So I would just stick to what people were doing last summer, that is making sure you're vaccinated now that we have that, but also masking in congregate spaces where there are lots of other people and staying outdoors as much as possible for outdoor activities. So being more careful with your children who aren't eligible for the vaccine.
You know, I'm curious because earlier in the original, forms of COVID, experts say that the kids weren't necessarily passing the virus on to each other, but now we're seeing more kids infected. Do you believe that this virus is infecting kids from adults that are unvaccinated, or are kids spreading it to each other?
You know, that's a great question. I don't think we really know the answer to that yet. We do know that children can transmit the virus even before the Delta variant. It's just that it appears that they're less likely to transmit. So we don't really know yet the answer to that, but we do know that they can transmit. Whether it's more now than before, it's not clear.
Sure. Let's go on to booster shots. The FDA is expected to announce it's authorizing booster shots for some people. Can you tell us a little bit more about that? And do you think eventually everyone will need a booster shot?
Well, in the back of our minds, we do think that at some point immunity is going to wane, even if there weren't variants, and that at some point there might be a need for a booster shot. But why this is coming up now is that the original studies for the vaccine started last year around this time, and we knew that we would have 1-year follow-up data to look and see how much the immunity is last a year on. So on Friday, we'll have a meeting with the CDC ACIP group to look at the data and see how well the immunity is holding up at this point and whether or not boosters should be used.
You've been such an integral part, I know, in the vaccine trials on children under 12. Earlier this week, or last week, we were thinking the vaccines were going to be available in maybe mid-winter. Now we're hearing maybe end of September. What are your thoughts on what you see the timeline being on that?
Well, the trials are going remarkably well. We have a lot of interest in this from families who want their kids to be vaccinated. The trials, as I said, are going well, and the data will be ready, we hope, very soon. And we think that the companies will be able to submit this data pretty quickly. And we think that sometime in early fall, there may be a review by the FDA. But we don't know the exact date.
We know a lot of parents are very anxious for their kids to get the shot, but there's also parents that are more hesitant, that don't want to get their children vaccinated when it first comes out. What do you say to the parents that are more cautious about the vaccine?
Well, what we like to do is really have them refer back to their provider. Pediatric providers are used to giving vaccines, are used to talking to families about benefits and risks, and we are keeping them up to date on all of this information. So when people have doubts, they should talk to their trusted pediatric provider or other healthcare provider.
All right, Dr. Maldonado, thank you so much for joining us. Always a pleasure.